Dr. Srivatsava, Sudhir Srivatsava, Dr. Sudhir Raval, Dr. Somashakar, Dr. Vishwa, and the galaxy of surgeons and my beloved engineers, media friends. I also join along with others. First, to congratulate Dr. Sudhir Vishwa and the entire SSI team for making this to happen, because this was more like a dream when we talked about in January conference. But the dream has come true today when we are talking about demonstrating Mantra 3. So this mantra, it definitely opens it up when you're talking about the future of the healthcare in India. You look at here, food security, I think reasonably we have done well. But coming to the health security point of view, definitely lot more room is available. And in that room, mantra can play a reasonably good role. I think that's what we're talking about there. And that to happen, such a technologies is concerned, this is basically a convergence of medical science as well as engineering science. So this happened, and technology-wise, I think we are seeing its viability. And from Mantra 2 to Mantra 3 is concerned, I think that I think reasonably well it has happened. And now I understand that today already a Mantra 3 system is in US, and that will showcase global in this arena how it is going to behave. And Dr. Fred Mars is another way of trying to show the acceptability is coming among the surgeons fraternity. When that is happening, beyond the technical viability, definitely when this has to move forward, you need the acceptability by the surgeons. Because I know I worked in 15 years back for the tele-education, EduSat was launched. I was a part of that mission. But unfortunately, though technically the mission was okay, unfortunately the acceptability among the teaching fraternity was not good that time. So that's why more or less that mission could not really fructify. But definitely during the COVID time, people understood. Now the tele-education is coming in a big way. But taking the lines from there, it calls for basically acceptability by the users. That means the education point of view, it is called for the professors and teaching faculty. And that I think SSI has taken such a way, bringing the people around. Dr. Sudhir Raval and Dr. Somashakar, people like them, they are part and parcel of this Mantra 3. I know that. I think they are the part and parcel of this Mantra 3. So that gives an acceptability by the surgeon, and a good number of surgeons also among these galaxies, I'm able to see the acceptability by the surgeons is coming there. But again, beyond further to go, because especially Dr. Sudhir was telling about, it's possible penetration in the nation like India, where it is called for affordability. Affordability is definitely, it's really required. And Mantra 3 is basically, when you look at here, I used to tell time and again, an innovation is called for, and the innovation is affordable innovation. I think Mantra 3 is nothing but an affordable innovation, wherein the complicated motors, the things have been in the place of that, the way in the new sensors have come, and the way in which the compact system has arrived at, definitely it envisages affordability is possible to provide that. Now, beyond that definitely is coming acceptability by the patients. They also, acceptability. I think today you look at here, I had the opportunity to go across very many these medical conferences and wherein the surgeons conferences, and I could see a good acceptability with respect to laparoscopy is concerned. And I think this is basically a graduation over that. So accordingly, I believe definitely when this graduation is taking place, acceptability of the patients also will come, especially a place like India, wherein we talk about nearly, I was told by an estimate, nearly 3646, a number for 1 lakh patients, 1 lakh population, this many surgeries are happening there. In that, nearly 30% of surgery, I was told it's happening between 30 to 50 years of age. This is the real productive age group of that, and they need to come forward at the earliest, and they need to get back to the work job also at the earliest. So there, I think this can play, laparoscopy has played a role, and here it can play a role. And there, Again, now you're putting the thing here, super specialty hospitals are there, surgeons are there, specialized surgeons, but the patients is nook and corner of length and breadth of India, country like this. So the connectivity is called for, also is called for. So there comes the technical viability of today's technical viability. Already symbolically they showed. Symbolically showed few miles away, not more than 53 millisecond latency, the surgery could be done there. Similarly, telepracticing point of view, even from Delhi to Bangalore, it has happened there. So now this graduate further in the days to come, definitely in the name of same Airtel's another low Earth communication, and or else Elon Musk's Starlink, that's going to go not more than additional 40 to 50 millisecond, another thing, anywhere to anywhere in India. So that means within 100 millisecond, patients can be attended to from the super specialty hospital to that. So that means the connectivity of surgeon without he being moving to the place, and the patient without he being brought to this place, I think that's possible. That's what we are talking about here. That means this can be Dr. Somashekhar can be sitting in his place, Dr. Sudhir Raval can be sitting in his place, without, till they can connect to a person somewhere in the nook corner of the primary health center of India. So that opens it up a big possibilities, and that to happen. So these are all the possibilities. That to happen, definitely we need the support of the policymakers, because we know beyond the food security, healthcare point of view across India, I think both central and state governments are trying to do it their own way. And I feel this can fit into that package also. There is that possibility also existing there. So putting the things together, this to happen, because I know there was a time people used to ask about why India need to go to space. We have a lot of issues within India, why we have to go like that. But India cannot afford not to have the space like that told. When that really is to happen, media played a reasonably good role. And that's why today, even Indian space program is one among the top when you're talking about that. Now we are going to take forward our Indian healthcare system also, one among the top in the world. Same space and our medical science can work together. So bringing the telesurgery in a real form, telediagnostic in real form, teleproctoring in real form. So that way happening, India can show the line what can be done to global arena also. That means what we talked today, January we talked about a possibility of this chair system. It's happened there. Today we are talking about a possibility, not a possibility, finite possibility of happening anywhere to anywhere in India, surgeon to patient connectivity, doing a real surgery is concerned. And that will show a way to the global arena for medical healthcare is concerned. That way, yes, India is rising. India is rising in the science and technology. India is rising in the medical science. And India is ready to roar for its own care. That's what we shown in the COVID. Not only it has seen to that its own population, it's definitely it helped for the other populace beyond its boundary. I think the day is not far. Today is the kickstart for that. Thank you very much for that.